Hello, my name is Dr. John Davis. I am with Eye Associates Overland Park. Start again. Hello, I'm Dr. John Davis, and I am with Eye Associates of Overland Park. Today I'd like to talk to you a little bit about LASIK and sort of the candidates that are really best suited for LASIK, who would be a good candidate and who might not really be a good candidate for that type of refractive surgery. In our practice, we have a lot of patients who are questioning LASIK. They're asking a little bit about that particular procedure and whether or not they would be a good candidate for this procedure. And so we oftentimes have the conversation of what types of things make you a good candidate. First of all, what we look for is we look for someone who, first of all, has a very stable refractive error. In other words, their prescription is not changing much from year to year. Ideally, we'd like to see someone who has had really basically the same prescription for about a 2-year period of time. The longer they're stable, really the better off they are. Patients who are not yet 21 years of age are really not good candidates because oftentimes their bodies are still changing and still growing. So really 21 is kind of the age where we start to consider someone a good candidate for the procedure. The candidate must be someone who is nearsighted. This particular procedure is designed to decrease the curvature of the surface of the cornea by removing tissue with the laser. And in doing so, you are flattening the cornea. So you're making that cornea less nearsighted or more farsighted. So someone who is farsighted really is not a great candidate for this procedure. The laser can manipulate the cornea and reduce farsightedness a little bit by taking off more tissue on the outer edges, but it's not quite as effective, doesn't have quite as of a long-lasting result there. Things that we kind of look for that would maybe dissuade someone from having the procedure would be a prescription that's extremely high. There is a limit to how much correction can be removed from the surface of the cornea. So if you have someone who's a very high myope, like a -9 or a -10 diopter prescription, we have to really take a lot of tissue away from the surface of the cornea in order to get them down to the 0 point or the 20/20 level that they desire. And if you take away too much tissue, you actually end up making the cornea too thin. So there is a measurement that's taken before a procedure is done to determine, is there enough tissue there in the cornea to allow us to really remove completely the prescription that the patient currently has. So those are all things that we would look at prior to having the procedure done. The other concern that we have is the amount of tear production on the surface of the eye, the wetness of the cornea. Many of our patients who are considering the surgery are also contact lens patients, and oftentimes the people who want the surgery the most are people who are really not doing well with contact lenses. Someone who has drier eyes is not really an ideal candidate for the procedure, and the reason is that when you do the LASIK procedure, part of that procedure involves making an incision across the cornea, and in doing that particular incision, you are cutting through some of the neural tissue of the cornea, some of the nerve tissue, and so there is a regeneration of that tissue. It does heal, but we don't get really 100% healing of that nervous tissue. That nervous tissue is responsible for triggering tear production when you blink on the surface of the eye. So each time you blink, there is a reaction or a response called the tear blink response. And so each time you blink, you produce more tears on the surface of the eye. And that is reduced a little bit having surgery. Now, right after surgery, every patient experiences some dryness, but if you have very dry eyes prior to surgery, this can really be a deterrent from having the surgery, and it can really cause long-term problems for those patients after the surgery. So for anyone who's had some real dryness issues with their contact lenses, they can't tolerate them all day long or really have troubles wearing contact lenses at all, those are patients that really are probably not ideal candidates for the procedure. So these are some of the things that we look at. We look at refractive error, we look at the thickness of the cornea, we look at whether or not the patient is nearsighted or farsighted, and we also look at the amount of tear production on the surface of the eye. These are all things that you would want to discuss with your eye care professional prior to having any surgery done. And these are things that we talk about with our patients here in our practice. Again, I'm Dr. John Davis. Thank you.